Good afternoon, everybody. We're just going to give everyone a minute to get to enter and get situated. Okay, it looks like we're all here. Good afternoon. Thank you all so much for joining us today. My name is Jake Berry, and I'm the Vice President of Policy here at New Futures. As many of you know, New Futures is a nonpartisan, nonprofit health policy and advocacy organization. As New Hampshire's designated Kids Count organization, we've been working for years to improve the health and wellness of all Granite Staters. And we're thrilled to join this afternoon with our friends from the New Hampshire Fiscal Policy Institute to discuss the impact COVID-19 has had on our children and families. Now, almost 2 years in, this pandemic is continuing to disrupt all aspects of life here in the Granite State. And we fear that without a comprehensive public health response, it will continue to threaten the health and well-being of our children and families for years to come. The good news is that thanks to unprecedented support from the federal government, we have significant new resources to invest not only in our immediate COVID response, but in reinforcing and reinventing the structures and systems that our families rely on. This funding creates a critical opportunity for our state, but we must work together to ensure those funds get to the right place. But before we get to that, let me start our discussion this afternoon by welcoming Mike Polizzotti, policy analyst from the New Hampshire Fiscal Policy Institute, to give us a sense of how the pandemic has directly impacted New Hampshire children and families. Throughout Mike's presentation, please feel free to put any questions you have in the Q&A box. We'll be sure to come back to them afterwards. Thanks so much for being with us here this afternoon, Mike.
Right, thank you, Jake. So I will begin sharing my screen, and we can begin. So I think everyone can see my screen. Good afternoon, everyone, again. So thanks, Jake, again. And my name is Mike Polizzotti. I'm a policy analyst with the New Hampshire Fiscal Policy Institute. NHFPI is a nonprofit independent research organization located in Concord, New Hampshire, and we examine the state budget, state economy, and the economic security of Granite Staters with a particular focus on those with lower and more moderate incomes. So before we begin, I'd like to provide a brief overview of what this presentation will cover. So before discussing the impacts of the pandemic, it's important to understand how Granite Staters were faring before the COVID-19 crisis began. So once we lay that groundwork, we can then discuss some of the disproportionate impacts and challenges created and exacerbated by the pandemic. And we can also discuss how some of the most acute effects were felt by those families in the Granite State who may have already been behind. And then we'll transition to opportunities to bolster the ongoing economic recovery as well. So to start, prior to the pandemic, about 1 in 5 households in New Hampshire had incomes less than $35,000, which is shown on this pie chart by the dark orange slice. And about 1 in 3 had incomes less than $50,000, as shown by both orange shaded slices on this pie. Additionally, levels of poverty varied significantly throughout the state. So the blue horizontal line on this chart represents the estimated official level of poverty in New Hampshire before the pandemic began. And individuals identifying as Hispanic or Latino, Black or African American, 2 or more races, and those with lower levels of education, children, and part-time workers all had higher levels of poverty in New Hampshire. So for perspective, prior to the pandemic, about 1 in 5 Black or African American Granite Staters lived with poverty level incomes or less, and that's compared to about 1 in 15 white non-Hispanic Granite Staters. There we go. And so as I mentioned earlier, children also faced higher levels of poverty in New Hampshire, as shown on the last chart before the pandemic began. And children who were identified as being Hispanic or Latino of any race or Black or African American faced higher levels of poverty overall than white non-Hispanic children. So using some free and reduced price school meal enrollment data in New Hampshire, we can identify a similar trend as shown in the last slide. So most children receiving free and reduced price school meals come from families with lower incomes, and these data show that a higher percentage of Black, Hispanic, Native American, and multiracial students were enrolled and eligible compared to white students in New Hampshire. And this indicates that children from these groups have lower incomes and are more likely to be in poverty. Disparities in poverty also extended to families as well. So the green bars on this chart represent the estimates for all families in New Hampshire with the attributes listed on the horizontal axis. And the blue bars show the differences for families headed by single women in New Hampshire. So these data show that families with young children, lower levels of education, those who rent their homes rather than own their homes, all faced higher levels of poverty. And these data also show that families headed by single women had substantially higher poverty levels regardless of other attributes. So for example, the estimated poverty rate for a family with children under 5 that's headed by a single woman was about 2 to 3 times higher than the overall level for all families with children under 5, children under the age of 5. And it's important to remember that about a third of all families with children under the age of 5 that were headed by single women before the pandemic began were in poverty in New Hampshire. So in addition to the pre-pandemic differences in poverty and the income distribution in New Hampshire, several key challenges existed as well. So typically the United States Department of Housing and Urban Development notes that families paying more than 30% of their incomes on housing are considered cost burdened and may have difficulty covering other expenses. And before the pandemic, just under half of all renters in the state were paying more than 30% of their income on housing expenses. And that's shown in this chart by the orange slice on the pie. So other key challenges in New Hampshire existed before the pandemic, including the uneven recovery from the Great Recession. The Great Recession lasted from 2007 to 2009. And during the recovery, wages for lower wage workers recovered much more slowly than the wages of higher wage workers. And this may have led to lower wage earners being less prepared to weather a future economic recession like the one that we've experienced very recently. Additionally, difficulties in accessing childcare were present as well before the pandemic. So as identified in a New Hampshire Department of Health and Human Services commissioned report, only about 60% of the need for childcare for children under the age of 6 was addressed by capacity that was available before the pandemic. So now with that background, we can transition to the impacts of the COVID-19 crisis on individuals and families in New Hampshire. So we've seen some profound challenges to the health and economic well-being of many Granite Staters over the last almost 2 years. And the economic impacts of the pandemic were uneven, with the most acute effects on individuals and families who were earning lower incomes. So we can start by looking at what happened to the workforce overall throughout 2020 and 2021 in the state. So the green bars on this chart represent the number of workers employed in New Hampshire each month. And the blue bars represent those who are unemployed, with the total height of these stacked bars representing the size of the labor force. So we can see that the number of workers employed has rebounded significantly since the initial impacts of the pandemic, and the number of those unemployed has declined as well. But we can see that the overall height of these bars, which again is the size of the labor force, is not back to pre-pandemic levels. Now, to be counted in these measures, employed individuals must have a job, and unemployed individuals must be actively or recently actively looking for work. So there appears to be some barriers limiting individuals in returning to work despite the overall improved economic conditions. And as I mentioned earlier, the employment impacts shown on the last slide were not evenly felt across the workforce. So the data on this slide represent the most recent analysis from August of high frequency private sector data analyzed by researchers at both Harvard and Brown universities. And this analysis shows that the largest employment losses were in lower wage industries, and that low and middle wage employment in New Hampshire saw some of the largest declines. So these jobs in lower wage work, which are represented by the red line, saw the most severe decline and also have not recovered to pre-pandemic levels in New Hampshire. Employment with earnings categorized as middle wage work, which is represented by the dark blue line on this slide, has recovered and expanded slightly beyond pre-pandemic levels in New Hampshire. And notably higher wage employment, which is shown by the teal line, recovered fairly quickly and didn't have as severe of a loss during the pandemic, and has grown significantly beyond pre-pandemic levels in New Hampshire, all when indexed to January 2020 before the pandemic. So as I mentioned before, it's important to remember that individuals and families experienced uneven employment and income impacts from the pandemic, and certain groups continue to face challenges in returning to the workforce. So nationally during 2020, unemployment levels for different groups of workers were not the same. So workers identifying as Black or African American and those identifying as Hispanic or Latino, along with those with lower levels of education, all faced higher unemployment. And additionally, there were elevated levels of long-term unemployment and underemployment, and the labor force participation of women declined more and recovered less than the male participation rate. In New Hampshire, so some New Hampshire level data shown that the labor force overall continues to be below pre-pandemic levels, and there are disparities between male and female workers in returning to the workforce. And also there were changes in labor force participation by age as well. So some of the challenges facing household as a result of the employment impacts of the pandemic are described here on this slide. So national level research has found that renters were more likely to lose their jobs during the pandemic, and renters also had less savings to endure times of unemployment as well. Additionally, about 38% of US households were estimated to be experiencing serious financial challenges, including paying for housing, affording food, affording medical care, or paying for other expenses. And in November 2020, about 1 in 4 US adults said that they were worse off financially than they were a year earlier. And about 11% of mothers and 6% of fathers nationally stated that they did not work in 2020 due to childcare challenges. And that highlights some of those disparities between men and women, and also identifies childcare as a major barrier in returning to work. So in New Hampshire, the US Census Bureau's Household Pulse Survey provides estimates for the difficulty covering household expenses generally in the state, which includes expenses for housing, food, health insurance, and anything else that's considered a usual household expense. So this chart here shows that from August 2020, which is when the Household Pulse Survey began asking this question, through October 2021, between 1 in 5 and 1 in 3 households in the state had reported that they found it somewhat or very difficult to afford their usual expenses in the last 7 days. Some additional estimates from the Household Pulse Survey found that from July to October 2021, about half of all households with young children participating in childcare experienced some sort of disruptions in that care. And from that same period, July to October 2021, about a third of households with children had received some type of food assistance due to challenges in accessing food. So given the information surrounding the challenges facing workers and families throughout the pandemic, both nationally and in New Hampshire, we can dig a little bit deeper into some of the workforce challenges in the state. So comparing the 12 months ending just before the pandemic, or comparing the 12 months just before the start of the pandemic and the most recent 12 months ending in August 2021, we can see which age groups haven't returned to the workforce. Now, there has been an increase in younger workers, so those workers under the age of 20 participating in the workforce, but notable portions of workers aged 20 to 34 and aged 55 to 75 have not returned to the workforce in New Hampshire. So older workers may have chosen to retire given the health impacts of the pandemic, and that may be contributing somewhat to the decline seen in that group. But these data on this slide show estimates for the reason as to why a New Hampshire adult is not working. So these measures were collected from July to October 2021, and it excludes individuals who cited retirement as a reason for not working. So about 7% of all respondents stated that they weren't working because they were caring for a child not in school or daycare. And this indicates that some of the challenges identified before the pandemic in terms of childcare capacity may have continued throughout the pandemic and continue to impact families and their abilities to return to work. Some additional reasons that are cited on this slide as behind not returning to work include caring for someone who has an illness or dealing with an illness themselves. So given what we know about the pandemic's impacts on workers and families that we've discussed earlier, along with some of the lingering challenges in returning to the workforce, we can turn our focus towards some areas that may promote a more equitable and inclusive recovery. So these areas include affordable housing, economic and financial stability, and childcare and caregiving, all of which were challenges that existed before the pandemic began, but they were exacerbated by it. So just to touch on some of the earlier policy responses and earlier aid packages. These earlier packages from 2020, they provided significant support to New Hampshire's businesses, nonprofit organizations, local and state governments, and individuals and families throughout the state. And this past aid was critical in providing support during some of the most severe economic impacts of the pandemic. But now the most recent aid, which is through the American Rescue Plan Act, will continue to support Granite Staters. So the American Rescue Plan Act provided both targeted investments in aid and significant amounts of flexible aid. So the state, counties, and communities in New Hampshire are set to receive a total of about $1.5 billion in flexible funds. And these flexible funds are time limited and they need to be spent by 2026. And they can be used for things such as direct relief, supporting housing affordability, childcare, economic security challenges overall, and a broad range of other opportunities. So all in all, there's significant opportunity to use these flexible funds to provide assistance to individuals and families in the state, and to help support a robust recovery from the COVID-19 crisis. And that's in addition to providing the immediate relief needed now by families and individuals in the state. So in summary, there are several important points to remember. So going back to the beginning of the presentation, the uneven recovery from the Great Recession left many families less prepared to weather the current crisis. And the COVID-19 crisis resulted in the most acute employment losses among workers who were earning lower wages. And this led to uneven impacts on certain groups, such as women and certain racial and ethnic minority groups. Additionally, many individuals have left the labor force due to challenges exacerbated by the pandemic. And this includes childcare or their health or caregiving responsibilities. And policy actions have contributed significantly to the recovery so far. And the American Rescue Plan Act provides some significant funds to New Hampshire for additional targeted investments and assistance to families and individuals throughout the state. And lastly, it's important to remember that that continued investments to support those who were most impacted by the pandemic and to connect individuals and families with resources can help foster a more equitable and inclusive economic recovery in New Hampshire. So NHFPI has published a variety of resources surrounding the impacts of the pandemic on workers and families, Granite Staters overall, along with several key resources highlighting areas for investments. So on this slide, there's a handful of these resources that are covering the impacts of the pandemic, all of which are available on our website, listed at the bottom, nhfpi.org. And this slide, there are a few more resources covering the American Rescue Plan Act as well. And this slide deck will be posted to our website. I'd also encourage everyone to visit the Income and Poverty page of nhfpi.org for some additional resources as well. And with that, thank you all for your time and attention, and I'll turn it back over to Jake.
Mike, thank you so much for that terrific overview. That's really compelling data and some really important takeaways. Next, let me introduce Rebecca Wojtkowski, New Futures Kids Count Policy Director, to talk a bit about our ongoing response to the pandemic. And please remember to submit any questions through the Q&A box on your screen. Rebecca.
Thanks, Jake. Good afternoon, everyone. Thank you so much for joining. And thanks to Mike for providing all that wonderful data as a backdrop for what we're going to talk about today. So today, the question is, what can we do to help children, kids, and their families, in particular, having this understanding of an uneven impact and real inequities that exist within our state. Next slide. So there has been a historic influx of federal funds. Nationally, $361 billion have been allocated for children from cradle to career. So that expands on all the categories that's listed here. That's a huge amount of funding for our state and states nationally. Next slide. And when we hear those numbers, you can think about a lot of things, but I think the main takeaway is that the federal funding alone cannot automatically address the challenges that New Hampshire's families are facing. And the data that Mike presented really drives that point home. Today, we're really going to take a look at early childhood federal funding and gaps within our state. A disclaimer, we're not going to talk about every single aspect of the early childhood system within New Hampshire. We don't have enough time. I'd love to do it sometime, but we're really going to focus on three primary priority areas. These are priorities in early childhood that we know are key interventions that help mitigate ACEs and also provide stability for families. There are also areas that we know that New Hampshire has made great investments in, but we are still lacking in what we could do for kids and families. So we're going to look at childcare, home visiting, and family resource centers. Next slide. For some context, this is our early childhood governance system. Just before the pandemic hit in March 2020, Governor Sununu issued an executive order that created a new early childhood governance system for the state of New Hampshire. This was on the heels of New Hampshire receiving the federal preschool development grant, which was a $26.8 million investment to build a better, more cohesive birth through 8 system for kids and families. So we have this opportunity to start looking at our system and the pandemic hits. It's important for context to understand what our early childhood governance system looks like, to really know where there's points of advocacy and who's working on what initiatives to really ensure that good policy is made. Next slide. And I want to talk a little bit, so we have context as we go through the different areas. How are all these federal funds allocated? There are multiple ways in which we have an ability to influence how federal funds coming into our state, whether they are one-time federal relief funds or potential additional funds coming through Build Back Better. Right now, you can go through the Governor's Office for Emergency Relief and Recovery. Their real job is to hear information, make recommendations around how federal funds should be allocated. Those recommendations still have to go through a number of other processes, including the Joint Fiscal Committee and the New Hampshire Executive Council. But there are opportunities and points to which we can have a concerted advocacy effort. We also have an opportunity to work closely with our state partners and councils like the Wellness and Primary Prevention Council or the Council for Thriving Children, who have been doing this deep policy work for many years, to work together to help make recommendations around where federal funds will have the most impact for kids and families. And additionally, we have the opportunity through legislation, and we'll likely see a lot of that in this upcoming session, where there are bills that are allocating and directing where our federal funds should be funneled in our state to make the most impact. Next slide. Let's talk a little bit about childcare funding. So we know there was over $100 million that came through federal resources to support and strengthen childcare in New Hampshire. And that really is a historic number. We have to understand the context to which those dollars were allocated for the state. In the early days of the pandemic, those dollars really were meant to stabilize the childcare market. As Mike outlined in his presentation, there are lots of obstacles to accessing childcare, and the ability to access affordable quality childcare is so important to the individual's ability to enter and remain in the workforce. So when the pandemic hit, childcare centers were on the brink of closing. A lot of those initial federal dollars went to stabilize the market, and we were successful in New Hampshire. We had very few childcare closures. Another amount of those federal dollars were spent to stabilize the field, understanding that the childcare workforce field was suffering from the same challenges as every other workforce field in New Hampshire and having a shortage. It was well known before the pandemic, and currently now that wages for childcare workers are low. So being able to recruit and retain folks to stay in such a crucial field is difficult. Another amount of the childcare funding was really directed at supporting low-income families who qualify for childcare scholarship. It's really important, again, as we talked about, being able to access affordable quality childcare is important in mitigating ACEs. It also has the importance for workforce. One gap in the funding that has happened to this point is it has not done a lot to help middle income families be able to afford and access childcare. Much of the relief that middle income families felt came through the one-time payments and also the child care tax credit, which is ending in December. So although there has been concerted effort around childcare on a federal and state basis, it hasn't really been geared to every income level. But we do know that every income level has trouble accessing childcare to some degree within our state, whether there is no childcare centers within their area, there's no availability due to a workforce shortage, or there is prohibitive based on cost, even with childcare subsidy. Next slide. And this is just a note to give a little bit more a deeper discussion. About 5,000 kids every year are served by childcare subsidy. Over 35,000 kids in the state of New Hampshire need some form of childcare. So we're still lacking, even though we had this amazing federal investment. Next slide. So just considerations, some of the things that I had mentioned. The $100 million was great. It didn't result in transformative change. It stabilized the market, which it was supposed to do, but we still have a long way to go to ensure that every child has access to affordable quality childcare. We know that we are dealing with a workforce shortage, lack of availability, and inequitable access for families. I really want to emphasize the data that Mike presented around the barriers with regard to race and ethnicity, as well as female-headed households. Those are things that we have to consider as we're forward thinking and as policymakers and advocates on what we need to do to really improve the health and wellness of all New Hampshire's kiddos. We also have to look at utilization rate for our child care scholarship program. Child care subsidy had a downward utilization rate even prior to the pandemic. And we need to look into what are the obstacles with that program. It's great to have a program that serves kids and families, but if families can't access that in an easy way, then we really need to look at how do we revamp it to make it a program that is truly accessible for all. The other thing is a consideration around quality. Often when we're faced in a crisis, especially a workforce crisis, some of the easiest resolutions for that are not the best long-term. So we want to ensure that we are respecting how important the field of childcare is, that we are encouraging and promoting policies which support the professionalization of the workforce and include education and training requirements as a priority. Next slide. So these are some of the concrete advocacy priorities that New Futures has identified that are really important when we think about what we need to be advocating for within the legislature in this upcoming session. We need to be supporting policy changes within our child care subsidy program that are good for providers and families. That's Senate Bill 144 that looks at enrollment-based payment instead of attendance-based. That really creates an even playing field for both parents and providers with predictable payments. We need to be looking at ways in which we support the workforce. This LSR 3089, which creates a fund to support those who want to remain in the childcare workforce to recruit and retain. We also need to be looking at policies that we've already implemented that haven't fully been implemented for lots of reasons. Senate Bill 570 from 2019 allows childcare access for parents in approved substance use disorder and mental health treatment. We have not had a full, broad implementation of that rule change. Advocacy is needed to show that that is still a really important avenue for a lot of families to be able to access childcare. And also we need to be forward thinking and looking at how do we create the necessary governmental infrastructure to draw down funds and build back better around childcare and mixed delivery pre-K. Both of those are aimed at not only low-income families, but middle-income families as well, and making sure our state is prepared to accept and take down those funds in a way that creates an equitable system is really key. Next slide. So I want to talk a little bit transitioning to home visiting. Home visiting is a really crucial support within our communities. If you don't know about home visiting, it's when a skilled nurse or social worker is paired with a family prenatally up to age 3. We have a number of different programs in New Hampshire. We have a high need, and our programs, even though we have both state and federal investment, still don't sufficiently comprehensively fund the need there. You'll see compared to childcare, the investment here is much smaller, but still vitally important. In 2017, a study by the RAND Corporation showed that there was a need of about 9,000 families were in need of home visiting. We know we still fall short every year of serving all those families within our state. Next slide. How we're advocating and considerations around this is that while we receive some enhanced funding through federal relief packages, we still had challenges within our own budget. We are working on the implementation of expanded Medicaid home visiting access. That rule has not been fully implemented now. That removes some barriers to allow more families to qualify. And this again is some data around how many families we have served in 2020. Next slide. So when we think about how we can use our voice to ensure that the federal funds that we have received are going to help families on the ground, we need to make sure that we are advocating for the swift administrative implementation of the Medicaid home visiting rule change. We're tracking where the supplemental HHS funding for McV home visiting is going and making sure that's being expended into the communities. We need to be working on aligned pieces of legislation. LSR 3089 this year looks at expanded postpartum coverage for new moms up to 12 months. So understanding that right now what we have is not sufficient. We don't want moms to be falling off of Medicaid coverage. We really need to keep the mom for a year and make sure that they're being connected with other community services like home visiting. We also need to do a lot with our legislative understanding of the importance of home visiting and how it's really connected to overall health and well-being of kids and families in our state. Next slide. Lastly, I really want to talk about family support funding, and this is really centered in our family resource centers within our state. New Hampshire has made a unique and strong investment in a facilitating organization model to create a system of family resource centers within our state. Family resource centers really sit at a critical place. They are sometimes aligned with co-located with child care centers, with other community-based services for families. They are usually the first point of contact because of a warm relationship with their communities for families in crisis. More importantly than that, most of the services at family resource centers are free of charge. Anybody can walk through the door. It doesn't matter your socioeconomic background, and be connected to services and others that will help families overcome crises. The biggest takeaway from for funding for family resource centers, there is no comprehensive funding in any federal relief package. And although New Hampshire has made an investment in a really important, strong model, we still don't have comprehensive funding. And every community does not have the benefit of having a family resource center. Family resource centers do provide some of those home visiting services that I discussed earlier, and they're really critical to the way in which we can deliver services to families within the state in a way that makes sense and is efficient. Next slide. So a recent report showed that just having access to family resource centers within your state can save your child welfare systems millions of dollars. So despite this growing evidence, we still don't have comprehensive federal funding. Data collection is really important. We are lucky that through advocacy of the Wellness and Primary Prevention Council, Family Support New Hampshire, the Children's Trust, and others, we are beginning to collect data to be able to show how important the impact of family resource centers are to our families. But we do not have comprehensive data at this point. The financial model still heavily relies on fundraising. Next slide. So as we begin to think, where could those potential federal dollars that haven't been fully tapped into yet, where could they have a great benefit? Family resource centers is one of those areas. And when we think about what we need to do for advocacy, it's both administrative and legislative. So we want to ensure that we continue to invest in that model that has been successful, that is working to build a stronger system of family resource centers within our state. We also want to ensure that we are promoting bills that support the services provided by family resource centers, even if there's a lack of comprehensive funding as a whole. Two of those bills coming up this session are LSR 3040, which is relative to childhood adverse experiences, treatment, and prevention. This is, with a fundamental understanding that family resource centers and the services provided therein help mitigate ACEs. They help families be thriving and strong. So we need to support that, among other interventions that the state needs to support, as well as programs like the one in LSR 2962, which reestablishes the farmers market benefit for WIC participants. So again, ensuring that the families that family resource centers are serving are being supported through various programs within our state. And the other aspect is really just administrative advocacy, pushing at both the state and federal level, that we acknowledge the important role that these centers provide to our communities, but that we support them with real dollars and not just rely on unpredictable fundraising for these centers to be able to stay open. So next slide, if I have one more. I don't. So with that, I'd say that though we have had this great influx of federal funding within our state, there's a lot of work to do. And it may seem insurmountable when you think about the different areas that you have to track, the different groups that are looking at how to spend these dollars. But I would argue that there's ample opportunity to raise your voice. Kids and families often do not have the ability to participate day in, day out in the happenings at the legislative office building, but it is opportunity to gather support in many different ways, raise your voice up, and ensure that the investments that we make within our state are equitable, that they are transformative, and they really do improve the health and wellness of our most important group, I would argue, our kids. Thanks.
Rebecca, thank you so much. Clearly, we all have a lot of work to do, and we at New Futures are looking forward to working with you all to ensure our state is supporting our children and families in a meaningful and equitable way. And now we want to open it up to our group for questions. Please, if you have any questions for our panelists, write them in the Q&A box. To get us started, I'll throw out a few. Medicaid enrollment has gone up, but SNAP enrollment did not increase, Mike, as a result of the pandemic. Given that you've shown information about how much need there is out there, can you explain this diverging trend?
Let me come off mute. There we go. So Medicaid enrollment, so most people haven't been disenrolled from Medicaid throughout the pandemic, but the increases or the expected increases in SNAP is what many people were expecting given the increased challenges. So the first round of extended unemployment insurance back in 2020 counted against the income requirements for SNAP and programs like SNAP. So individuals might not have been income eligible, or they were newly eligible because of the impacts of the pandemic and didn't know about the program. But subsequent rounds of unemployment, expanded unemployment, did not count against SNAP for eligibility, but these individuals may have been denied the first time and didn't know that they could reapply and then receive benefits if they were experiencing hardships in accessing food. So one of the main reasons behind this may be a lack of information. So these individuals may not have known that they could have reapplied, known that they would have been eligible, or even known about the program if this was the first time they were experiencing some type of significant economic hardship that we saw earlier in 2020. So NHFPI has done some analysis on SNAP and enrollment and other factors like that before the pandemic. And we found some connections to lack of outreach and the need for more information and connecting people to these benefits that may be able to be applied to some of the reasons we haven't seen SNAP enrollment increase during the pandemic.
That's great, Mike. Thank you very much. We did have a question submitted through the Q&A box. Rebecca, you posted an answer, but maybe we can just speak it aloud. The question is, were the federal dollars given only to licensed child care centers?
And the answer is no. To that, there were a couple of programs in which childcare centers could apply for federal relief, and believe one is still open until the beginning of January. So we can ensure that we provide some resources for folks to look at that if you're interested. That comes from the understanding that not every child is in licensed childcare, and there's a system of parent choice, and there's relief for anyone who's providing childcare.
Wonderful. Thank you. Thank you. Mike, another question for you. It seems like many people who have left the labor force are older. Is that being driven by retirement, or are there other factors?
Sure. So for the older age group, there's a combination of things, including people may have been feeling more vulnerable from the health perspective, so they retired early. But it's important to remember that for the last 2 decades, the labor force participation of individuals aged 65 to 74 in New Hampshire has been going up. So this may just be part of the readjustment back down. But it's also important to remember that New Hampshire's demographics are fairly skewed towards older individuals, which will continue to provide some workforce constraints in the state. So while a significant number of older individuals have left the labor force, the state, and there'll need to be investments made at the state level to help ensure that younger individuals who have left the labor force can return, and that goes back to the childcare issue, and also ensuring that there's affordable housing for younger individuals here as well to help support the labor force.
Thank you, Mike. We got a question in the chat from our friend Kim. It mentions Mike's presentation highlighted significant inequities and income inequality for Granite Staters of color before and as a result of the pandemic. Rebecca, what targeted policy approaches are we advancing to address the root causes of these inequities?
Thank you for that question. I think it's really important. I think first and foremost, it's a discussion and acknowledgement that these inequities exist in every level of the system. It's analyzing what are the obstacles when we think childcare, for example, who is accessing childcare, who isn't, and why not? And then beginning to build policies based on the federal funding that approach and have a foundation that access is for everyone. I'd secondarily say that when we think about even the policy work, we have to start thinking about who's at the table. And I'll let Jake talk a little bit about New Futures campaign for remote access. I think that one thing the pandemic brought to us was this opportunity for more individuals to be at the table, using their voice in the legislature, and that gave new pathways for underrepresented communities. So making sure that when we think about the policies that we're making, it's not just the same folks around the table, that we're engaging with under-engaged communities to understand what policies need to be implemented that are important to them, and bringing that conversation to a wider group. So I would say that right now, I can't list a specific policy or bill that's in the legislature that specifically addresses the race and ethnicity and equities within our state, but it's more the opportunity now to make sure that the policies that we are going to create and how we use our federal funds keeps that as a top priority and goal and guiding star as we engage with communities. And Jake, can you just talk a little bit about the Rural Access Campaign?
Yes, thank you for bringing that up, Rebecca. I think that really is terribly relevant to this question in particular, and to our discussion today and so many of the others that we're having as the legislative session draws near. As Rebecca mentioned last year, I think we saw one of the few positives that we experienced under COVID was really the growth and broadening of the amount of voices represented in the legislative process. Due to the public health crisis, we saw the legislature was forced to move their operations to Zoom for part of the 2020 legislative session and all of the 2021 session. Because of this really allowed people to engage in different ways. It allowed people to testify before committee hearings remotely over Zoom in a way that they hadn't before. We know that many people have, due to economic concerns, geographical constraints, many other factors are unable to make it to the State House during the day. So our legislators last year were able to hear from thousands and thousands of new voices who had not engaged that way in the process before. Unfortunately, to this point, the legislature has not announced any plans to recreate that for this coming session. They did recently announce that they are moving their full legislative sessions, which engage all the lawmakers themselves. They're moving those to Manchester to be able to have more social distancing and other precautions in place, but they have not announced any plans regarding their legislative hearings or other proceedings that are public facing to allow for remote or Zoom access, which is a great disappointment to us, I think it's safe to say. So to combat this and really to stress the need for this remote access, once again, New Futures is partnering with many partner organizations throughout the healthcare and early childhood fields, among others. We have a petition going that's available on our website that we're nearing 1,000 signatures on so far. We are working with our friends and partners in the press to have some opinion pieces printed throughout the state to really stress the need, and are really pushing calls and emails directly to the legislators themselves to again stress how important this is for the public at large, to allow voices from across our state and across the spectrum to be heard during these times of crisis. So if you would like to join us with this, we would love to work with you. We will certainly post a link to the petition in the chat, and we'll try to include it in a follow-up email as well. And we would love to work with you on this or the other legislative initiatives that we mentioned today. Let me see. So I think we have one or two last questions here as we wrap up. First, Rebecca, can you share more information about the legislative action around ACEs? What will that legislation do or fund?
Sure. So I don't have the full text of the legislation right now, but my understanding is it pushes the state to consider investments in true primary prevention, interventions that we know mitigate ACEs. So places within our state budget that have not been fully funded, but that we know are really important to helping kids who have been not only exposed to trauma, but preventing it in the first place. I would encourage you, if you're interested, to sign up for our newsletter. We will be sure to include links to the bill text and updates about how the bill is progressing through the legislative session, as well as further information. If you're interested in participating more in what is going on in the early childhood work, let me know. You can sign up for our Early Childhood Update Coalition calls, which will resume in January as well, all depending on how much in the weeds you want to get on early childhood policy within the state.
So I think that's a great place for us to close out this afternoon. I really want to thank you, Mike. Thank you, Rebecca, for passing on this important and always relevant information. As Rebecca said, we at New Futures would be eager to work with you in any way to address these or other priorities facing our state. So thank you all for being with us here this afternoon, and we look forward to our continued work together.
Thank you.
Thank you.